Hello, everyone. My name is Kristen Wakeford, and I work at the Cardinal Health Fitness Center in Dublin, Ohio. Today's What's What webinar, we're going to be talking about self-massage. So if you have a lacrosse ball, foam roller, foam rolling stick, anything that you use to stretch, I would grab those out so that way you can kind of follow along, or when I give you some options for exercises, that way you can kind of try them out yourself. So let me get myself sharing the PowerPoint slides. Just give me one sec. All right. All right, so like I said, self-massage is what we're going to be doing here. So test your knowledge. Self-massage techniques can be highly customized to meet individual needs. So true or false? I'll give you a couple seconds. All right, so it is true. So each individual is in control of what techniques they use, when they use them, how they use them, like what you use as well. In fact, many techniques can be done in a very short period of time, and it may not be best to overdo some techniques. So you can always adjust them. So first off, what is a massage? So it's manipulation of soft tissues of the body. There are many different types, so we'll talk a little bit more later on that. Optional tools may be used. Again, we'll talk a little bit more on that, but there are, like I said, lacrosse balls, foam rolling stick, foam rollers, bands, anything like that. Let me go back to that actually for a sec. So the many kinds of massages that you can kind of think of, Swedish or classic massage is the most common type in Western countries, and other types of massage may be specific to certain needs. So like a lot of Olympic athletes go to a certain sports therapist for their type of massages. They use a lot of trigger point therapy. They do the suction cup ones, stuff like that. Those massages will reduce the muscle spasm, stuff like that. However, this model focuses mostly on self-massage techniques. So we're not really going to be talking too much about those, but just wanted to let you know about them. All right, so examples of self-massage tools. I've said it for 3 times, so hopefully you know what some of them are. So first one, foam roller. I actually don't have my foam roller with me. It is in my garage, but it is that orange long cylinder one. That's the very first tool that they use. I feel like most people think of that as the kind of golden standard. A lot of people use those. They're really helpful, especially in the glutes and the quads, and a lot of other areas as well. Rolling stick, I do have one of those, so that's that second one. These ones I usually like to use for the quads a lot, the calves. Other than that, there's not a lot that you can do by yourself with it, but besides those two. But I will have my fiance sometimes do my upper back, or some areas that I just can't really reach as well. But these are super, super great. Love to do those. So I will definitely be showing you some with those. That third one, massage cane. So it looks like a cane. It kind of has that hook. That's really good for kind of putting over your shoulder. You'll find a spot that you kind of feel like a knot, or kind of a spot that you feel has a little bit of tension. You hold it there kind of like a trigger point, and it will help relieve that tension. There's also other places you can use them, but that's the most common one. And then balls, so tennis balls, lacrosse balls, softballs, baseballs. So the one thing to note on these is that although you might have one of these laying around, some of these ball sizes are a little better for certain areas versus others. So for the lacrosse ball, I love the lacrosse ball. We use it a lot. It's great to kind of put it on your back and then walk up, or kind of go up and down on a wall, and massage that way. But most of the time when you're laying flat on the ground and all your body weight is on the ball, you may want to use something a little bit bigger, like more like a softball, just because that can get very, very painful with all your body weight on it. So different tools may work better for different parts of the body. It's important to use what's comfortable, tolerable, and know that when you're doing these techniques, it may feel good, and you may think that like I need to go to the point where it hurts because that's going to relieve the pain. That's not always true. I've had it where I've done it on my glutes, and the next day I barely could walk because I was so sore. I was so just, I think I overdid it on my glutes, and it just was painful. So it kind of like bruised underneath my glute. So you want to take it easy and then ease into it. Maybe go lightly the first day. If you didn't feel like much, then ease into the next day. Well, I'll go a little bit longer. I'll go a little bit harder. But just focus on how your body feels and don't go to that point where it's unbearable. All right, so now we know the tools, so let's talk about how massages work. So it will calm the nervous system, reduce stress hormones, promote circulation, may help block some pain signals, help soft tissues with muscles, tendons, all that relaxing. And to talk on that, if you hit or bump your arm or leg against something and it hurts, what is the first thing that you're likely to do? You're probably going to rub it without even questioning it. So, you hit your funny bone on something and you immediately just start going, oh my God, ow, ow, ow. So technically that is a form of self-massage. So it's going to kind of use all of those techniques that we just said, reducing the stress and calming the nervous system, all that stuff. And also just to try to, I always use an example too of, you are about to pluck like your what are these called, eyebrow hairs. So you pluck that, and most of the time that first one is so painful. You're like ow, 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 ow. But then after a couple, it doesn't really hurt that much. Your skin kind of becomes a little bit more numb to it. So it's kind of like a similar aspect of this. Something might be painful when you hit, and you're going to kind of rub that area to kind of expose it to a little bit more, so then it's not quite as painful. So for calming the nervous system, we'll go a little bit more deep in all these. Calming the nervous system, it may help to slow heart rate and decrease blood pressure. For the stress hormones, it's going to just decrease them. For promoting circulation, it's also going to increase your blood flow. It's thought that pressure signals from a massage may compete with pain signals, possibly blocking some of the pain signals from reaching the brain. So that's exactly what we were just talking about, how rubbing your arm against something, you may bump it and it might start to feel better. It's going to block some of those pain signals. And then lastly, like I said, helping with the soft tissues, they'll just help the muscles and tendons relax. So let's move on. Benefits of massage. There are many, many benefits, but we're going to talk about a few. It's going to relieve stress and promote relaxation. It'll help to reduce discomfort. It'll improve your sleep. It'll help with certain health conditions, so anxiety, depression, fibromyalgia, arthritis, back, neck discomfort, so many different things. According to the NCCIH, massage may be beneficial in certain cases in health conditions. Studies are often varied, but maybe talk to your physician if you're feeling, a discomfort always in your back, or when you wake up, you're always feeling really tight. Maybe ask if, massage would be a good way for you to tackle that. And they may give you some answers. So we're talking about why self-massage. So let's get all these up here. So it will relieve tension before or after physical activity. This can be related to just your daily life, your weed whacking or you're pulling weeds, you're mulching, and you're in that bent over position the whole time. You're going to feel very, very tight once you get out of that position. And I think a lot of you felt that. I think one of the number one things that I've always had was wrapping Christmas gifts or birthday gifts. I'm very hunched over on the floor for 2 hours or whatever. And the moment you go to get up, you're like, oh my God, my back hurts. It's going to hurt tomorrow even more. So you don't always have to think of it as a workout only needed when you're working out. It's beneficial all the time. It's best to focus on the problematic areas, such as muscles with extra tension from those post activities, and helping recover those muscles and tendons, and reducing that delayed onset muscle soreness. So second one, it's going to help improve your range of motion. So mostly why yoga and stretching and all that stuff is so beneficial, because not only everyone always says, oh, you just gain flexibility. Yes, that's true, but it's also going to help your range of motion in all other aspects of your life, not just to do your downward dog or, your lunge. It's going to improve. Maybe you like to play tennis on the weekends. You might be able to get a full swing now. It could be even running. If you have really, really tight hamstrings, you're not going to be able to, get maybe open up your stride a little bit more. But after, doing those stretches and improving your range, you may be able to get to that range of motion. And then number 3, help relax sore tissues as recommended by a health professional. However, it's important to use it carefully in cases where there is an injury and to work with a healthcare professional. So make sure you talk with someone if you have an injury, but it most of the time is beneficial. All right, so let's go on to the next slide here. When not to use massage. So this is actually really interesting. I think a lot of people always automatically think you always should massage something, but I'm here to tell you that is not always the case. So let's get all these up here first. In areas of recent surgery, injury, or infection, so we definitely don't want to massage. If you just had stitches, we don't want that. In areas with open wounds, swelling, or bruises. So you're going to want to get the swelling down before you really massage it. I mean, I know it's a habit, like I said, you hit something, you're immediately going to start rubbing it, that's fine, but I wouldn't go really deep into it. I wouldn't get your lacrosse ball and really put your body weight into it. Let that swelling and the bruising come down before we inflame it anymore. Anything with direct pressure over bone and veins. So I think that's pretty known of. I think when you're massaging and you go right over the bone, it's pretty painful. So most of the time you really can't get far with it. Maybe you have a really high pain tolerance and you can deal with it, not me. Other when there's extreme discomfort, like I said, last one, we probably won't do that, but just keep in mind if you have a high pain tolerance, maybe ease up if you're even feeling just a little discomfort. And then with certain health conditions, there are certain ones that are not recommended, such as osteoporosis, acute or severe cardiac, liver, or kidney disease, diabetes, pregnancy. You want to check with your doctor first, and conditions that affect your connective tissues or alter sensations. All right, so we're going to move on here. Finger massage. So use a pinch grip and massage both sides at the same time. Repeat this for 30 seconds on each finger. Massage both sides in the top and bottom of the finger. So literally what the picture's just showing, you can just grab, you can pinch the side. You're going to start to see the white coming from your skin a little bit, so the blood starting to kind of go to the side just because you're creating that pressure. But you're just going to hold it here. You want to do top, you want to go up to the bottom, just some easy fingers. There's not a lot of finger massage techniques in the world. There's a lot more other places though. But again, don't overdo anything, but you may want to do these every once in a while. I know a lot just kind of moving the fingers a lot, wiggling them, spirit fingers. I know a lot of people will do fingers on the table and they'll push them forward, and then you'll go ahead, tuck them in. That's kind of getting the wrists in a little as well. So there's a lot of options for those. Arm and foot massage. So this one is absolutely great. I love it. So first one, let's talk about the foot one. So let's go to that right picture. You're going to see that lacrosse ball, or there's a bunch of different types that you can use. It doesn't have to be a lacrosse ball, but you typically want something a little softer that it can kind of mold down a little bit, but still firm. And you're going to want to put that ball on the floor. There we go. You want to put that ball on the floor. From there, it's going to be in the middle of kind of like that arch. And you can kind of just roll it around forward and back. And if you feel there's a point where you really feel some tension, it feels, pretty good to keep it there. I would keep it there for, 10 seconds or so, roll it around again, and then keep doing that until you feel like that discomfort or tightness has eased up a little bit. For the arm, we're going to be focusing a little bit more on like kind of the forearm area. For that one, you're just going to want to put that ball on a bench or something that is nice and stable. And from there, I'm just going to put my palm facing up. I'm going to go ahead and put that ball in between that surface and my arm, and go ahead and you'll just kind of roll the ball around until you kind of feel that that intensity isn't quite as strong. If you feel one part that's a little more intense than the other, hold it there or kind of just do little pulses. So those are some great ones as well. Back massage, these are the ones that I use all the time. So let me get up here. So the first one is the one I was talking about not too long ago, where you're going to get against a wall. So here is my lacrosse ball. I'm going to put it against the wall. From there, I'm going to go ahead and lean back, nice tall back onto that wall. And from there, I'm just going to go up and around. I'm going to go in circles, left to right. Be careful not to really clip your spinal column too much, because that bone on bone is going to feel, or the bone on the ball is going to hurt a little bit. But you can just kind of feel it in that upper shoulders until you feel that point where you feel that tension. Hold it there, kind of get that release of the tension. You can do the same exact thing, but on the ground. I like to usually do on the ground closer to my glute area. It's kind of like a lower back. So I like to go right here near the tailbone. It is important to know that I don't completely let all my body weight just like fall on the ball. I usually like to keep my hips up a little bit, and then I kind of ease into the pressure. So obviously the more my body weight's on it, the more intense that ball is going to feel. The more I lift up my hips and glutes, the little bit less it's going to feel. But I always like to usually hold these positions, feel it, hold it, and then I'll move it just a little bit over, move it to left to right. But I usually don't like to roll too much with it. I feel like that holding really helps me. Calf massage. So I don't have my foam roller, but you can see he's just having his feet right on top of it, and he's going to prop up his body weight with his palms, and he's just going to go forward and back until he feels that the calves are getting a proper release. Another option is using one of those sticks that I have, and you're going to basically do the same thing. You're just going to kind of hike up one foot, and you're going to grab that bar underneath it, and you're just going to roll side to side, up and down. Beware this one. Whew. It is surprising how tight your calves are. You use them all the time. You're walking, especially if you walk inclines a lot, or you tend to walk a little faster, your calves are going to be super, super tight. So sometimes I like to get my fiance, and I'll flip over onto my belly, and he'll just kind of rub with the stick on my calves, and that is super intense. So what will you do next? Identify a body area to try self-massage. Try a simple self-massage technique. Talk with your medical provider, injury prevention specialist, all of that. I will put some, a link on our website to some other stretchings that you can do with all these materials. There's some that I haven't even touched with quads, especially with the rolling stick, rolling out the quads, or you can lay down on the ground kind of like a plank, and you can roll with that foam roller. There's just so many things out there, but also just Googling things kind of to get a base understanding of it. Other than that, we are done. Thank you. If you have any questions, just let me know. Other than that, have a wonderful day.